Welcome to Spine Guy. I'm Dr. Brian C., a fellowship-trained spine surgeon. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. If you see a spine doctor, chances are we're going to order an MRI of the neck or back. The MRI is a specialized imaging study that looks at the bones, the ligaments, the tissues, etc., and it really probably is the best view that we have of the spine. An MRI involves going to a small tube for about 20 minutes, and there's lots of noise because there's these two magnets that are spinning, and these magnets obtain this really crisp picture. Usually when you get the MRI, these magnets are graded by strength, either 1.5 or 2 Tesla. Both are fine for the cervical and lumbar spine. Both give really good resolution. The one thing is make sure it's a closed MRI and not an open. So there are these open MRIs where you aren't in a tube and it may seem nice, pleasant, non-claustrophobic, but you're really not going to get as good of an imaging study. Here you'll see the difference between a closed scan and an open scan. You'll just see how one looks like high definition TV, the other one looks like a TV from the 1970s. Usually for my patients, if we give them a Valium just to help sedate them a little bit, getting the closed MRI is not a problem. So you get this MRI, and what happens is these images get transported to a reading room where the radiologist that sits in front of all these monitors, and this radiologist is going to read out every little thing in your spine that looks different than an absolutely normal looking spine, which obviously not everybody has. And this is for a couple of reasons. One, radiologists went to school, they did residency, they did medical school. They are trained to look at every specific thing in your spine, and that's why it's so comprehensive. Secondly, even though they know that probably only one or two things on the scan are really causing your problem, they haven't really had the chance to examine you or take a history because it's usually the spine doctor that does that. All they have is a little one-liner that we provide them, and often our medical assistant provides it, and it really just says clinical history. It may say something like leg pain or back pain, etc., and that's really all they have to go on. And lastly, the real reason they read everything out is because...
We do that because we feel like if we don't say everything, then you'll come back, you'll call us and you'll want us to talk about those
I see. Okay. Now, sometimes with the advent of electronic health records, patient gets access to their MRI scan, the MRI report, before they can even see their doctor for follow-up. This report's often 2-3 pages long, and patients will look at it and start freaking out because there's so many things that are called out at every single level. Remember that the length of the report, the complexity of the report is obviously subjective. It's based on the radiologist, but naturally patients get very concerned. So this whole video is to tell you to please be careful. Don't read too much into your MRI report. And this is because as you age, the spine also undergoes normal age-related changes. I tell patients it's like getting gray hair as you get older. These are normal things that happen. Or it's like having a car that you drive for 20, 30 years. There are normal things that happen that may not be an issue. Some of the normal age-related findings in the spine include disc degeneration, disc herniation, stenosis, spondylolisthesis, scoliosis. The majority of these changes are likely not even cause of your problem, and typically they don't even cause pain. There's a great study from the 1990s where they looked at asymptomatic patients. These are patients that don't have pain, but they did an MRI anyway just to see what kind of MRI changes they may have. In patients over 60, 1/3 had disc herniations and 1/5 had lumbar spinal stenosis. They did a very interesting follow-up study 7 years later where they re-scanned everybody and saw who developed changes and who didn't, and they actually found that even patients that had original changes didn't really predict whether or not you develop back or leg pain in the future. Here's another study where they looked at 3,000 patients. These patients are again asymptomatic, and you can see that as you age, you can get more and more of these changes, which again are just normal age-related findings. When patients get over 60, almost 100% have disc degeneration, 50% have facet arthritis, and 25% have spondylolisthesis, which is abnormal slippage in the bone. So for spine care, as you've seen from many of my videos, we treat the patient, not the imaging study. And this is even if you have severe spinal cord compression, we really need to do the physical exam, see what your symptoms are. We are treating you, not the imaging. Many patients have horrible looking MRIs, but in fact they have very little pain. And conversely, many patients have absolutely normal looking MRIs, but they come in with 10 out of 10 pain. This is a patient of mine with back pain. He's in his 60s. The report does read out certain things, but when I look at this, I see normal age-related findings. I didn't really see anything too bad on this scan, but yet he has horrible pain. With all that being said, the Spine Guy channel exists because stenosis, spondylolisthesis, disc degeneration, it is possible that those things are causing your pain. It's really important for you to go to your spine doctor with the imaging studies. They can look at the imaging studies, do a good physical exam, take a good history, and really tease out what things on the MRI, what things on the report are actually causing your pain. To that point, it's super critical for you not to only bring in the MRI report, but more important to bring the actual images on a CT scan. It may sound old school, but CT is really the best way to get images to your doctor. Sometimes you have an electronic portal where you can see the images, but if you don't, more often than not, a CT is really the best way. So if you're gonna look at the report, this is what you'll see, and these are the things you should look out for. So obviously it'll have your name, date of birth, medical record number, make sure that's accurate. It'll have your history, which is that one-liner clinical symptom that we provide to the radiologist. It'll tell you the technique of the magnet, how strong the magnet is. Sometimes it'll have a comparison section. It'll compare it to an old imaging study that you had maybe a year ago, maybe 2 years ago, to see how things have changed. It'll then have a findings section. The findings section is really the bulk of the report. It's going to read out every abnormal thing at every single level. So in the cervical spine, it'll read out C2-3, C3-4, C4-5, and it'll be in these short sections. Really what you should look at is the impressions and the conclusions section. The impressions and conclusions section is what the radiologist thinks are the most important findings within the whole scan, and they'll summarize them for you. So there are in fact 3 key buzzwords that you should look out for in the impressions and conclusions section in this spine itself. The first is infection. Rarely will the report use the word infection. That's kind of a layman's term, but we'll see the terms discitis and osteomyelitis. Discitis is an infection of the disc. Osteomyelitis is an infection of the bone. This is one of my patients. Sometimes this can be interpreted as degenerative disc disease at the L2-3 level, but in fact, the radiologist read this out as infection, which was correct, and the treatment is obviously very different when somebody has an infection. Next is fracture. As patients get older, they can develop what's called compression fracture, which is a collapse in the bones. Sometimes these are acute, which can cause pain. Sometimes these are chronic, which usually don't cause pain, but that is something to look out for. Lastly, most importantly, is cancer. The word cancer you'll rarely see in the impression and findings, but you will see the word malignancy, which means cancer, and you also see the word metastatic disease, which means that cancer has spread to the bones in the spine. As spine doctors, like I said, it's really important to have the actual imaging. I'm usually glancing at the report, but I'm not usually glancing at the report to see the findings in the spine. I'm glancing at the report to look at incidental findings. So incidental findings are findings that are seen not in the spine, but they were actually caught on the scan. So when you get a lumbar MRI scan, 90% is the lumbar spine, but 10% really are the soft tissues that are surrounding the spine. So in the lumbar spine, that can be the liver, the intestine, the prostate, as well as the uterus. In the cervical spine, we're often seeing the thyroid gland as part of the cervical spine scan. So sometimes masses and things can be found in the soft tissue that's adjacent to the spine. And you'll see this under the impression section. The radiologist will say something like recommend follow-up, or recommend clinical correlation, or recommend more imaging, such as an MRI, a CT, an ultrasound, etc. If you see something like that, that's an incidental finding in your scan, that is something that you should bring to your doctor, bring to your primary care doctor, bring to your spine surgeon and say, hey, do I need to do something about this? Lastly, please do not be one of these patients that prints out your report, takes a highlighter and highlights every little single thing that's wrong at every little level, and then bring it to your spine doctor and say, here's an entire page of highlights, please explain to me every little thing that's wrong with my spine. As you've learned from this video, most of those things that you're going to highlight are simply not relevant, and they're probably not even causing your pain. At these appointments, we have about 15 to 20 minutes to go over the imaging, the physical examination, the history, and the formula plan. If we spend all the time going through every little single detail, that's going to be a total waste of time, and you're not going to be able to really focus on what's important, which is formulating a plan based on the 1 or 2 things on the report that are really causing your symptoms. So hopefully you learned something about how to be very careful when you're reading an MRI report of your spine. Thanks for watching. Don't forget to click like and subscribe.